Our subject of discussion this week is dry eye. We say good morning to Dr. Joel Saylor.
Good morning. Yeah, dry eye, and I said dry eye to give you a break this morning. The proper term for dry eye is keratoconjunctivitis sicca.
Yeah, dry eye.
Dry eye, or KCS, either one. So you can call it dry eye, KCS, or keratoconjunctivitis sicca. Now, this is one of those issues that also people get. Okay. And when you go to the drugstore where they have the contact wearers, things, right, you'll see a whole section and a selection of products for dry eye in people. I actually have it in my eyes. I had some eye surgery done, and as a result, anytime that happens, you run the risk of having dry eye. And so what's interesting about dry eye is we see it occur naturally in dogs. A lot of these short-faced dogs have it. You've probably even seen one of these dogs at some point, the one dogs that have the kind of mucusy looking eyes, and the eyes are black like little black hard super balls. That's basically due to chronic dry eye. And what happens when the eye becomes dry, then it becomes irritated. And then instead of producing a liquid or aqueous tear, it produces mucus. Okay? And the mucus then further irritates things, and it's a downward spiral. So you really want to catch these early on. Now, it's easily diagnosed, okay? Because all it takes is basically doing what's called a Schirmer tear test. It takes exactly 2 minutes to run, 60 seconds in each eye, and you measure how much tears the dog produces. And most dogs should produce over 15 millimeters, okay? And if they don't, then they run the risk of being in that KCS. Now, if they have KCS, then the goal is to try and stimulate tear production and keep the eye lubricated. So there's usually a combination of two things. We usually use an ointment that has cyclosporine in it, which helps reduce the inflammation. In humans, they use the product Restasis, okay, which is a drop form of cyclosporine. But we've had an ointment, and we've used it quite a long time in dogs. And you use that twice a day, and then the rest of the day, as often as you like, you use an eye lubricant. The goal being is early on you want to get aggressive with these, because if you can keep the eyes lubricated, you can reduce the inflammation, and then more tears will produce. Right. Ironically, the more irritated and inflamed the eye becomes, the less aqueous tear is formed. So you really got to jump ahead of these, and you can keep those eyes protected if you're very aggressive with treating these. So if you've got one of those dogs that got a mucusy kind of eye, you basically might want to get it checked and ask your vet if they can run a Schirmer tear test.
Could that hurt the vision of a dog?
Oh yeah, absolutely. They basically, because what happens, that black super ball look, the cornea becomes pigmented, so they literally can't see through it anymore.
Wow.
And so behind everything's working, but it's like a curtain has been pulled because of the chronic inflammation. So again, if you got something like that going on, ask your veterinarian if you can run a Schirmer tear test. It takes, like I said, 2 minutes, and then you'll know what's going on.
All right, and we'll be back right after this.